So this is one of my videos in the Everything You Wanted to Know About Botox series. And in this one, we're going to be talking about Botox to the forehead. So there's three most common areas that people get Botox, and one of those is the forehead. So the forehead is obviously this area here, and you've got this big flat muscle across here, which is called the frontalis. So it's this thin muscle, imagine like, like a thick bit of cling film going all across the forehead here, and it's a puller-upper. So its action is to lift. So this is me completely relaxing my frontalis, my forehead muscle, and then this is me contracting it, lifting it up, and obviously you start to get lines developing across here. And some people have a really strong muscle and they can create really deep lines, and it's almost, you can see the muscle rippling. I actually have a fairly weak frontalis. Some people don't have any muscle in the middle. It's got like a V-shaped one, so they lift up and it's almost just little lines just at the edge. But the important thing about this muscle is that as it's a lifter, what you're doing with the Botox is you're relaxing it, so you are actually allowing it to drop down a little bit. Now, where that's important is that some people actually use this muscle to lift their eyebrows a lot more than others. And particularly as you get older, we find that people use this muscle a lot more for that reason. So you always need to be really careful and have a good look at the patient, or at least I need to work out whether they're going to be somebody that's likely to find that they feel, if you put too much here, a bit of heaviness actually within the brow. So everyone's forehead muscle is different. Some people have a short forehead muscle. I said earlier that sometimes you can have a V-shaped one. Some people have really long foreheads. So the same thing doesn't work for everyone. So some people just need 5 areas across here. Some people need another row at the top if you've got a long forehead. So you always have to have a good look and just see exactly what they need. So most people, or on average, would have about 5 injection points across the forehead. So 1 in the middle, 2, 3, 4 and 5. Some people with a high forehead would need an extra layer across the top. So I had some patients who have come to me and said, I've had Botox before, but when I raise my eyebrows, I get this little ripple across the top. And so they need that second area. Or I do find sometimes as people have had Botox for a number of years, they start to recruit the muscles. It's almost like the muscle at the top starts to get a bit stronger, and then we need to start adding just a little tiny bit across the top just to get that as well. This is the muscle which I think it's nice not to over Botox, because people are going to notice if you're not raising your eyebrows. This is when you're going to get the frozen look. So I think it's nice to have a natural look here. So you want a little tiny bit of movement, but you don't want it completely frozen. Something to consider with the forehead muscle, which I alluded to earlier, is that this is a lifter. So particularly at this outer part of the eyebrow where it's using it to lift, we don't want to put too much Botox in and create a bit of heaviness there. So for people where I think, oh, you're really using your muscle here to help lift, what I tend to do is put just a tiny bit of Botox in here, because we want to get rid of the little lines just at the edge of the eyebrow, but we don't want to drop it too much. I want to say to them, as I'd much rather see you in the next 2 weeks and find actually we need to put a little bit more in, or maybe it's perfect, rather than see them in 2 weeks and they just think, oh, that was just too much. And then you've got to wait for 3 months till it wears off again in order to get it right the next time. I'm Dr. Pavey. Thanks for watching the video. I hope you found it useful and interesting. If you have, please like the video and also subscribe to the channel, because we are just about to be doing lots and lots of videos about how to get great skin. If you have any questions at all, or you're interested in the treatments I provide, we would love to see you at the clinic. We're in Reading, we're in Wallingford, and we're in London, and you can just send us a message and we'll get back to you. We're looking forward to seeing you.